The abdominal examination method of Leopold's maneuver is a way to determine the position of a fetus inside the uterus by touching the abdomen by hands. This method is expected to enable expectant mothers to perceive the fetal position and stimulate the awareness of child presence.
Good day, ma'am. I am Harold Merwin Taruk, your student nurse for today. Ma'am, pwede ko po bang malaman yung pangalan nyo? How about your age, ma'am? Your birthday po, ma'am.
Before proceeding to the assessment, do hand washing.
Okay, Mrs. Gray, I will be performing the Leopold'S maneuver, which means I'm going to touch your stomach to determine the position of your baby. Okay lang po ba yun, ma'am? Okay po. Before we proceed to the procedure, we need to provide privacy for the whole assessment. Okay po, Mrs. Gray, pwede po bang umihi po muna kayo bago po tayo magsimula sa procedure? For you to be able to become comfortable kapag ka po pinalpit ko na po ang iyong stomach. Okay lang po ba iyon, ma'am? Okay.
After that, place the patient in dorsal recumbent position, supine with knees flexed to relax abdominal muscles.
The first maneuver is what we call the fundal grip. So before touching the patient, we need to rub your hand first.
Using both hands, feel for the fetal part lying in the fundus. The purpose of this is to determine the fetal part lying in the fundus and to determine the presentation.
The second maneuver is what we call the umbilical grip. The purpose of this is to determine the fetal back and the position of the baby.
One hand is used to steady the uterus on one side of the abdomen, while the other hand moves slightly on a circular motion from the top to the lower segment of the uterus to feel for the fetal back and small fetal parts. Use gentle but deep pressure.
Okay. Third maneuver is what we call the Leopold'S grip. The purpose of this is to determine the engagement of presenting part, whether is it engaged or not.
Using thumb and finger, grasp the lower portion of the abdomen above symphysis pubis. Press in slightly and gentle movements from side to side. The fourth maneuver, or pelvic grip. By facing foot part of the patient, palpate fetal head pressing downward about 2 inches above the inguinal ligament. Use both hands for this procedure.
Okay, ma'am, tapos na po.
After the procedure, place the patient in a comfortable position. Do hand washing. note all the assessment, and documents the procedure done including findings.
Okay po, Mrs. Gray, tapos na po tayo sa ating procedure. And ito na po yung results. So, babasahin ko na po sa inyo, ma'am. The results are, in LM1, your baby is in the cephalic position, which is normal presentation. Ibig sabihin po nun, the head of the baby is in the presenting part. In LM2 po, or ibig sabihin po rin is Leopold'S maneuver 2, the position is left occiput anterior and the fetal back is palpated and the heart rate of the baby is 127, which is within normal. Sa LM3 naman po, your baby is floating, which means she is not yet engaged, which is normal naman din po for 7 months pregnancy. And lastly, the LM4, the baby is in the vertex attitude, meaning a good attitude for a good delivery. And that would be all, ma'am. And thank you so much po.
Damn. Yeah.